fewer than 10% of people in New Jersey have received at least one dose of the COVID-19 vaccine. Nearly 2 months into the vaccination campaign, less than 2% have received both doses. Governor Murphy has blamed the departed Trump administration and Walgreens for the sluggish start, but is he right? Here to answer that is an expert we have turned to repeatedly throughout this pandemic, the Dean of the School of Public Health at Rutgers University, Dr. Perry Halkitis. Welcome back to the show.
Oh, thanks for having me. It's my pleasure to be here.
It's good to see you. What's your assessment of what the governor has said? Does his administration bear some responsibility for the sluggish rollout or not?
If we were not seeing the pattern across every state, I would say it is the governor's responsibility. But the fact of the matter is that the pattern we're seeing in New Jersey, we're seeing in multiple states throughout the United States. What does that mean to me? And what have I come to understand? What I've come to understand is that the previous administration, the Trump administration, dropped the ball. Operation Warp Speed turned into Operation Snail's Pace. And as a result of that, the vaccines were not rolled out. Governor Murphy and Commissioner Persicelli were often left in the dark about how much vaccine they were actually getting. So it was like a hit or miss situation for a while. I expect things will get better in the next few weeks.
Now, the governor has talked about there being a supply issue. Are we talking about, so from production point to distribution or to the actual centers? What do you know about that? Is there an issue in the supply chain getting it out?
So there, in the previous administration, there had not been a stockpile created of the vaccine. The Biden and Harris administration have revved up the Production Act, the Korean War Production Act. So there was yes, there was a problem in the actual supply that was available. Number two, there was then this disconnect between the state and the federal government. And what happened there is that the governor and the commissioner would ask the Trump administration for a certain amount, and they would get some different amount. What is different now with the Biden-Harris administration is that the Biden-Harris administration is telling Governor Murphy how much vaccine is actually going to come into the state. And so therefore, he and the commissioner and all of us are much better prepared to indicate how many doses will be out there. So it's like it starts at the top and it filters down. The other problem is it looks like we have vaccine that hasn't been used in the state, and that's just false. Number one, the data are always lagging behind. But number two, we have to remember that with 2 doses, even though there are a bunch of doses still sitting around, those are often for people who need their second dose. So it's not like people are hiding the vaccine in like warehouses or in the trunks of their car to prevent us from getting it.
What are you finding in regards to vaccine hesitancy? How big a problem is that?
It's an enormous problem. So fortunately, I've written recently about this idea that politics shape public health, and I totally believe this, and I think there's substantial research to support that idea. What we've seen, fortunately, over the last month is that vaccine hesitancy has been on the decline. But let's think about this historically. Vaccine hesitancy does not come out of the blue. We have members of our population, often marginalized groups, often brown and black people, specifically the African American population, which for decades and decades and decades have been subjected to medical mismanagement, medical abuse. And for that reason, there is this distrust. We also have a segment of the population who is very distrustful of the Trump administration and the speed by which this vaccination has actually been developed, these vaccines have developed. Let me just say this to that group. To my African American friends, I completely understand like where you're coming from, and what the abuses have been atrocious. To people who think that we've cut corners, that's not true. We've been thinking about these viruses, these SARS viruses, since the first SARS epidemic in the early 2000s. So that's that. And number three, just historically, there are a group of people often on the more educationally attained end of the spectrum who have a distrust of vaccines because of some false information based on the damage it does to children. So all those come together, and you have a complex vaccine hesitancy reality, which means to tackle it, you need different approaches for different populations.
And lastly, just with the last few moments we have, the governor's goal is 70% of the adult population by Memorial Day. Do you think we're going to get there?
We can get there if the production continues at the federal level. I think the governor and Commissioner Persicelli have been really smart about thinking about these large spaces where people will go to get vaccinated. And let's just face it, once you do it, your friends want to do it. And so the normalizing of getting the vaccine is going to also speed it up. So I hope that we'll have some sense of a little more normal summer in 2021 than we did in 2020.
Using peer pressure for good. Thanks to you, Dr. Perry Halkitis. You're always welcome on this show.
Thank you for having me.
As for you, stay with us. There's a lot more coming up today.